So happy Wednesday. It's a hump day, as we call it. Beautiful day. It's 9 o'clock on the East Coast. I've been up since 4. I had some sessions overseas, people who are applying for the match. And unfortunately, time zones are real. So if you're in the IST, like in India, it's challenging with the time zone. So I usually see my international guys and girls early in the morning, because then my afternoon it's all whacked out. So I'm happy you guys jumped on. I was just checking my phone. People are passing. People are doing very well, passing steps, scoring high in step 2. Success stories are real. They're there. You know, some people don't score as high as they want in step 2. Unfortunately, you know, I'm getting statistics as we move on. I'm doing a lot of step 2 training. So I'm very confident by the end of the year, I have really good statistics specifically to gauge the standard deviation on the NBMEs versus the 120s, because I got people scoring like 255, 260s on NBMEs consistently, and they only score like a 242 on step 2, versus others score 265. I think it's mainly user error. I think it's meaning it's 9 hours instead of 8. It's 8 blocks instead of 7. So the extra 40 questions is intense. Plus the scenarios are huge. So, you know, I typically tell students, and also for step 1, if you feel that endurance and stamina is not your strong suit, if you feel that stamina and endurance will affect your performance, if I was you, I would simulate this exam a few times before I go in. Like, meaning on a weekend, I would literally do 6 blocks with multiple little breaks in between to simulate the test. And if I can't do 6, I won't be able to do 7. And if I can't do 6, I can't do 8, that kind of thing, right? Some people freak out, they panic in the test centers. So they have those test drive options where you go, you pay a couple bucks and you test drive the facility. So you could do that. Take the 120 in the facility, you could do that. There's options, right? And nowadays there's tons of options. So that being said, and I hope you understand, I talk to you all as much as possible, but I really need you all to think, if you are nervous, if you do panic, if you have some sort of anxiety when it comes to taking tests. Some students are on some medication, other students do certain breathing techniques, other students physically go to the test center and practice the test drives twice a week, because it'd be a shame to study so much, to do very well, and to know your knowledge and to know your medicine, to go in and bomb because you freak out in the test center. So if that's you, I'm not saying it is, but if it is, then you should be able to address it now. Because I've talked to some students, and after working with them for a few months, then finding out that they panic, I'm like, man, that's not good. You know, you could study all day and still fail, right? So it's a performance thing. Anyway, so today we're doing microbiology, as we do every Wednesday morning. Last Wednesday, we covered bacteria. That's the first week. Second week, we do viruses. Third week, we do fungi. And the fourth week, we mix it up. We do some parasites, a lot of farm, mix up with bacteria and viruses, because a month goes by is a lot of time, right? So that being said, I know some of us hate virology, like Dr. Anthony, who's taking his test tomorrow. So he's gunning away, reviewing a few things today. He's always like, man, I hate viruses. But why? You know, viruses are just points, right? You have single-stranded, double-stranded DNA, RNA. If you look at the 2024 versus 23, they took out 𝗘𝘅. They don't have that anymore, so don't worry about the sides. Mainly, you got to tell me, hey, this is the condition. Is it an RNA virus or a DNA virus? And honestly, if you look at your first aid, you look at that perch pneumonic, right, which is the second virus from the top, that's a good indication of maybe they ask you that because there's 5, 6, 7 diseases linked to that family versus, you know, chikungunya, right? Or those kind of like West Nile, East Nile. Like, they're never going to ask you that stuff. That's a little too exotic, too rare. But they ask you hepatitis A, Coxsackie, herpangina, stuff like that. You got to know it, right? And it'd be a shame if you don't know if it's DNA and RNA. I know I talk a lot, but think of it. One side, other side, nephritic, nephrotic, restrictive, obstructive, DNA, RNA. It's all 2 sides. Learn how to differentiate. Yesterday we did repro. Yes, we did. So it's nice when we went over breast cancer, because some are benign breast diseases, some are breast cancers. Intraductal or ductal. If you can't differentiate those, how will you differentiate them on the exam? I laugh because I laugh at myself. I thought I knew it all. And I realized that I tried to memorize. It's not possible. So If viruses are your friends, that's amazing. If not, we'll see. I chose about 20, let's see, 20 questions or so. I got to change my setting because I was using Amboss for step 2CK all this morning. So I'm going back to step 1. Give me a second. So I hope you guys are doing well. Hope you guys, have a certain schedule of test in mind. If it is, let me know. Share with me on the back end. Let me know what you're thinking so we can pace ourselves moving forward. That being said, when it comes to viruses, DNA, RNA, we've done many, many times. I would focus on that to know what is which, what is what. Antivirals, big, HIV therapy, just like anti-diabetics that we cover, they're not difficult. You just have to know NRTIs, NNRTIs, integrase inhibitors, protease inhibitors. You just got to learn the categories. Like I've shown you many, many times. I've done it many times. I'll keep doing it. But you need to know it, right? Today, I want to focus on torch infections. I want to focus on a couple viruses here and there. These are points that you need to get on exam day. It is my goal and my duty to review these for you and to unravel and to highlight certain things that you might have maybe overlooked or maybe forgot or you haven't reviewed as much, right? You say, uh-oh, this reminds me that I should go back and review because these questions aren't hard, but they're very challenging if you do not know what the organisms or the viruses are listed below, right? So I also chose a couple hepatitis questions that I need you guys to do. So raise your hand because I used to hate these tables with e antigens and core and IgM and surface antigens and which is vaccinated, which is not vaccinated. But clearly we got to do them, right? These are very, very high yield questions to a point that they'll throw that on your test. And then people kind of panic because they go, uh-oh, I'm not familiar with the markers, but why not? I mean, maybe the school didn't teach you to the right way, but there's videos out there. First Aid has a great, replication of the photo, like a beautiful picture in First Aid, as well as Amboss itself. So raise your hands up high. Someone has to participate. Again, I've done these questions, so I'm here to help you answer these questions. And we'll have a couple of easy ones at the beginning, and then we'll throw a couple curveballs around to make sure what you know. Not that bad, not difficult questions, but at the same time, challenging if you don't know what they are. So let's see, let's participate. Let's raise up our hands. Clearly, I want you guys to participate so we can see what we know versus what we don't. We'll do some questions live together, all right? Let me pull one up. I'm waiting for you guys to participate. Let's see. Let's pull up a question. Let's see. So yeah, waiting for you guys to raise your hands or I'll just cut the session short and then we'll jump to the afternoon because these live sessions are not for me to do the question. These are for you guys to do the questions. I've done these questions. I've participated. I've passed my test. Now it's your time. So let me just pull up one of these questions here and let me share my screen. Dr. Singh, man, come on board. You're saving the people. I love it. It's tough love this morning, guys. How you doing?
Good, how are you?
I know you wake up early, so thank you for joining on the West Coast. So I appreciate you. How was yesterday studying?
It was better. Like I was able to do some questions, but it's
Mhm.
still, I didn't do like a full like 40. I was able to get
Okay.
20 in like 2 blocks of 10s.
Okay. So let me ask you this before we go. And again, these are the building blocks of studying. So that's why I ask, or else, because I mean, I care. That's why I'm asking you, right? And I hope that you understand that I do care for you all. She had one full day, 2 blocks of 20. You said of 10 or 20?
10.
10. And then the 10, so you took time reviewing, and then did you look at the answer choices? Did you then dig deeper in videos, books? How did you attack these 10 questions for these
Yeah,
22
so
tens?
the questions that I had to use like hints on, those
Mm-hmm.
ones I made notes of so I can go back and look at them in like Amboss and see what information I was missing to answer the question. And
Okay.
then the ones I didn't use the hint and chose the wrong answer, I try to look at what made me think that it was a different answer. That
Yeah,
way
I mean,
I could
okay,
keep track if it was like more content or if it was just me not reading into the question.
that's the best way. You do it tutor mode, you get it right or wrong, immediately look at why you got it wrong, go to the question stem and see where in the question stem led me to what happened that I chose this answer, right? And then you go look at the right answer, and then you could take your notes, highlight whatever you want, but you have to make sure to assess why you thought that was the answer. A lot of people don't do that. What they do is just keep moving, answering more questions. And they finish a whole cube and they go, I'm at 52%. Then they do it again and they realize the score doesn't rise as much because they don't focus on why they got it wrong. They just read the answers and they move, right? So this is important to figure out why we thought it was what it was. So keep pushing. 2 blocks of 10, great. After that, we're going to bump it up, right? 2 blocks of 15, 2 blocks of 20. Eventually, keep pushing. You have to, especially if your test is coming up the end of August.
Yeah.
So you have to find out from school, because if that's a deadline, you got to get going. And if you have more time, that's awesome. Cool. Yeah, good.
Yeah.
All right. So we're doing viruses, guys, this morning, as we always do the second week of every month. I chose different questions. I did general virology, some torch infections, some hepatitis questions, which are pretty cool. And I hope you guys are doing the sets. If you don't, I get it either way. I'm just adding these sets for you guys to have access to, so you can have a good list of questions too. These are high yield points that you need to know. I take my time, I pull questions out for you, because people say, what do I need to know? Well, this is what you need to know. So you got to do it, right? All right, let's do it, Doc. Let's attack the question. You have our teammates here. Good morning, Jamie. From the north side, we have East Coast, West Coast, Canada covered. Good stuff, guys. Good stuff. All North America except Mexico. All right, let's do it.
Okay.
Not yet.
Cardiac examination shows a continuous heart murmur. There are several bluish macules on the skin that do not blanch with pressure. Slit lamp examination shows cloudy lenses in both eyes. The newborn does not pass auditory screening test. Which of the following is the most likely diagnosis? Okay, with the continuous, okay, so patient has PDA and sensory neural loss. And then the blueberry muffin skin, I think, is what it's referring to with the bluish macules. So I'm thinking this is rubella.
Okay, so this is rubella. Now, you know that we're all familiar with these infections. The issue with step one is familiarity is what causes us to fail. We're familiar with this information. Yeah, but do you know it? Well, not so much. That's why we do these questions, because you need to know how to be able to pinpoint an infection and use the findings to our advantage. So now it's rubella. That's awesome, right? The answer, we see rubella is here. You want to hit it?
Yeah.
Good. 77, 79%. So rubella has the triad. You need to know all this information. You need to know it. There's no shortcut. You need to know it. Either you read it, you memorize it, you write it out 10 times, or you make in that. I just don't know. Everyone works differently, but they will provide you something. They told you eye problems, hearing problems, heart problems, typically PDA or pulmonary artery stenosis. Okay. They'll never tell you blueberry muffin. They'll explain to you what blueberry muffin is. You need to know. So now basically rubella infection occurs during the first 8 weeks, usually only results. If the transmission occurs after 16 weeks, the risk is low. That's kind of nice. Good to know, right? So maybe you didn't know that before. That's why I emphasize, if you knew with the triad, if you knew eyes, ears, and heart, congrats. Learn more. If the fetus gets infected past 16 weeks, it's actually less of a risk versus the first 8. Okay, it's important. It's very important to know. Do me a favor. Do you know any of these other ones? Any presentation of the other guys by any chance? Prodigal?
Yeah, so parvo, that one, they would give you more of like the lacy rash.
Okay.
And then